First of all, we'll start off with the paramedics and how they found the My Health handover. The My Health handover sheet is a fantastic tool because it is the way it's set up is set up in the coded colours is a system that the New South Wales Health are familiar with, and it's short and concise. So depending on, as in this case, it was the paramedics who attended for this particular client, the staff and myself were able to use the piece of paper, and as soon as the ambulance arrived at the scene, and of course the first thing we're able to do is give them that handover. They immediately looked at the first stop, which is the red signal, which is the short bit of information that the paramedics need. They don't really need anything beyond that. It's the first critical, first responder type information that they require. And that was extremely helpful for them because what they require to know is background information, so a medical summary as to what's wrong with them. And then secondly, the most important part for them equally is their medication. So all of that sit at the very front part in the red section. So for them, it was walk in, there it is, thank you very much, that's fantastic, that's what we need, and they were able to immediately go and assess the client. So for them, that saved them a lot of time. For staff, it was fantastic because traditionally in the past, we would have had to dig through all our files to find out where all information was, which is all in different parts of a file that's about yay thick, which is near on impossible in the time frame you've got. So you make the call to the ambulance, you call 000, and you've got about 10 minutes. Meantime, you're looking after a client and looking after what their issues are, and you're trying to find all this information in 10 minutes, which isn't going to work. So for the paramedics, My Health, fantastic. So for example, this is a good one. Now, they have to admit IV antibiotics. Now, IV antibiotics is pretty invasive in that if the client at that time it's not unusual for them to be dehydrated. So now we're having to go into a vein if they can't find the vein. This particular client, we couldn't use the left arm. Again, part of the critical. She had lymphoma. So therefore, one arm's out of action, we can only use the right arm. So in this particular case, again, there are other options, but because we know what their likes and dislikes are, the staff were able to approach the client better. The staff supporting the client were able to support that client. So even if they had limited information about the client, and they were, say, even if it was a casual staff member, they would be able to read that information and they would have a bit of inside knowledge about how to support that client. And if they didn't, the nursing staff with more experience would be able to understand it better. So that information is there for them to use for invasive procedures, such as IV, blood, if they need a full set of bloods, which the client did. Again, because that information is there about likes and dislikes, how to approach the client, they dealt with it very well. So these stages are critical based on the care as it goes along over time. So is it a great document? It's a fantastic document, and it ticks all the boxes for both staff and for the hospital and makes that process much better.